I'm Dr. Venkatesh Ramaiah. I'm the Chief of Vascular Services and the Network Director for Vascular Services at the Honor Health Network in Scottsdale, Arizona. I'd like to take this opportunity to highlight a few features of the ALTO Stent Graft that is used in the treatment of abdominal aortic aneurysms. As you can see on the right-hand side, this is the picture of the ALTO Stent Graft. And two characteristic features of this stent graft are the suprarenal elements, which cause and allow for fixation. And then the mid-body, just below those elements, is the sealing zone. And the differentiating factor of the ALTO graft compared to the other endografts in the market is the fact that the sealing zone is achieved with the use of polymer technology. And this allows for much less neck dilatation in the future compared to the other stent grafts, which use radial force of metals to allow for adaptive sealing. So let's highlight these features with a case that we've done, probably one of the first with the ALTO stent graft. So this was an 82-year-old male patient who came in with a 5.7 centimeter abdominal aortic aneurysm. We worked him up. He has significant comorbid conditions. In fact, he's also had a TAVR procedure. On the right-hand side, you can see a really large aneurysm with really dilated iliac vessels, which are the bifurcation vessels at the level of the umbilicus. So, and also you will see this is also a very tortuous aneurysm with a relatively short neck. So let's look at further pictures of the pre-case planning. So on the left, you'll see that the patient has significant aortic angulation. It also shows a very large aneurysm. You can measure the size, as you can see. And it also allows us to really place the ALTO stent graft three-dimensionally to see how it will look within the aneurysm itself. The question is, why did we choose the ALTO stent graft? And the reasons are very simple. One, it is the lowest profile device on the market, but this patient has fairly large vessels, so I think it could accommodate the other devices also. But the key feature in this particular case to use the ALTO device is the neck angulation and also the relatively short neck that this patient has, but also a neck length of 7 millimeters. It's probably the shortest neck that you can treat with the ALTO device without any ancillary equipment. So that's why we chose the ALTO device. It allows us to confirm to the angulation, the morphology, and the diameter of the neck of the aneurysm. And these are very extremely important features that makes this device stand out compared to the other devices that are available. On the left is the preoperative picture, and you can see the left renal actually has a stenosis, as a little blockage there. The neck is relatively short, and it's also very angulated. And that is the reason why we chose the ALTO graft. In the next picture, you will notice that there is a sealing ring that is well deployed right below the lowest left renal artery. And this is how the ALTO graft allows us to make use of the entire length of the neck. The sealing rings are very well visualized. And prior to even deploying the graft, you can actually see exactly where the sealing rings are going to sit. Sometimes we remove the stiff wire that we use to put the graft up so that the graft will actually mold to the angulation and the morphology of the aneurysms. And once we are confident that the sealing ring, which is made of polymer, is seated right at the level of the left lowest renal artery, we then allow the polymer to expand. The fixation is done with the suprarenal elements. And as the polymer expands the graft, you will notice that it sits right at the level of the renal arteries. Now, as the polymer expands, we wait till about 14 minutes before we can do anything. But in the interim period, we cannulate the gates and we put the extension limbs all the way down to the iliac vessels. And on the extreme right-hand side, you will see that the two limbs are widely patent. You can see that there is no dye going into the aneurysm, as you can see on the left side where the aneurysm is extremely large. And you can also see the sealing rings seated right at the level of the lowest renal artery with excellent seal and fixation. So these are the highlights of the ALTO device. And then this patient was actually one of our first few patients that we treated with the ALTO stent graft, which was, I think, approved in September of 2020. And you can see on the left-hand side, the suprarenal metal elements that allow for fixation of the stent graft. But you see a gap between the suprarenal elements and the limbs of the graft, which have metal in them. And that's because the neck of the aneurysm, the adaptive sealing zone, is made of polymer. And once the polymer is completely set, the contrast, which is there at the time of deployment, slowly fades away or gets reabsorbed over a period of 30 to 60 days. So you will notice that there is almost a gap between the top fixation and the limbs of the endograft. A lot of people have reported this as migration or separation of the components, but you got to understand that polymer does not highlight as metal in the other endografts. So the seal zone is made of polymer, which is basically one of the few mechanisms that decrease the amount of neck dilatation that can happen with the current self-expandable stents that are utilized in other endografts. If you look again at the level of the aneurysm sac itself, you will see that the aneurysm has actually shrunk a little bit from 5.7, 5.8 to 5.5 over a 2.5-year period. And you'll also notice that all the contrast is within the aneurysm sac, and there is absolutely no evidence of an endoleak. So this patient has done really well in 2.5 years, but we'll continue to monitor him closely. But again, the features of the ALTO graft allow us to treat patients with complex aneurysms such as this.